My name is Cristina Alvarado. My topic is los tips or cause of partial olar treatment of endocarditis. Definition. It is the inflammation of the intro lining of the valve and chiro cavities. Endocarditis can be the infection, myocardium, usually bacteria that go forming some charande structure of vegetable.
Endocarditis means inflammation of the inner layer of the heart. The heart's wall is made up of three layers, the epicardium being the outermost layer, then the myocardium, and then the endocardium, which is the layer that gets inflamed. It turns out that most cases of endocarditis are due to microbial infection of the endocardium, usually involving the endocardium lining the cardiac valves.
Application in use. Control of viral cysts, especially the patient. Temperature timing the way antiviral as well as blind cough are affected here. Introduction to the family member above the quart, the preaching chef risk control page.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right, guys, let's begin. So the easy way to remember all the main causes, use our acronym DRUMS because your heart kind of acts like a drum. So D is for dental or oral surgery. We give prophylactic antibiotics and also degenerative heart disease called Marfan's syndrome. Now R is for resistance to major antibiotics. Even if your patients take these prophylactic protective antibiotics before their dental appointments, guys, they might not even work if they have long-term resistance to major antibiotics. Which brings up our next point, U. U is for untreated strep throat and even untreated rheumatic fever. This is a main cause here. Huge test tip. Untreated strep throat can lead to an even nastier infection called rheumatic fever, aka rheumatic heart disease. And then to endocarditis, and then to death. Who would ever thought that a sore throat could lead to a broken heart? So M is for major heart surgery. We all know that repairing heart valves can be risky, but even CABG, so yes, a CABG, a coronary artery bypass graft for heart attack patients, or even implanting pacemakers. So guys, anything that opens the heart up during surgery to any possible infections is a huge risk for endocarditis. And lastly, S is for sticking dirty needles, even for medical use, tattoos, and even piercings. Guys, anything that opens your body up to infection, whether it's
Post a cause. Post. The prognosis may change in patients if early diagnosis and therapy of endocarditis in perform. Blast causes serious level in the increase of the temperate treatment is legal support and is a provider multidisciplinary surveillance and symptomatic management of application.
Hey guys, Nurse Mike here, and welcome to SimpleNursing.com. Before we get today's lecture started, please remember to access your free quiz and preview our cool, nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right, guys, let's begin. Now, infective endocarditis is not only caused by throat infections. This strep or staph infection can also enter the bloodstream from many other ports of entry, either from dirty needles or even dental procedures. Either way, the little bugs enter the bloodstream and find their way to the heart, where they nestle into small cracks in and around damaged heart tissues, and even around newly placed valves where the tissues are still healing after surgery. Once they locate an opening, the germs set up a nice little home for themselves, most commonly on the left side of the heart, in the mitral valve and the aortic valve. This little party grows little by little into a big rager, eventually clogging the valve doors in the heart, which impairs the pumping action. This impaired pumping can be heard in a weird little swishing heart sound that sounds a lot like this. Now, this eventually leads to a less forceful contraction in the heart, meaning less oxygen-rich blood being pumped out to the body. And guys, again, less cardiac output means less oxygen to the body. Now, guys, before you try to memorize all those signs and symptoms, always recall in your mind the pathophysiology first. It makes everything a whole lot simpler. All right, so what's really going on? Well, infectious vegetation starts growing on the heart valves, right? And this makes it hard for the heart to keep a tight seal and pump correctly. This leads to low cardiac output, causing low oxygen to the body, and in severe cases, it can lead to heart failure, failure for the heart to pump. So we use the acronym CLOT, C-L-O-T. The C stands for clots in the heart and body, either from the swirling of blood in the inflamed heart or even breaking off of moldy vegetation.
Isolo a play in Ecuador. Study Corey and studied three incidents of 17 cases per 100,000 and Jaber per year in relate to hyperly patent the incident in estimated 0.16 per one dose administration. Endocarditis is a rare infection with an incident of 70 questions per 100,000 engagement per year.
I'm Peter Block at ACC 2019 in New Orleans, and with me is Henning Bundgaard from Copenhagen. And he has just finished talking about an endocarditis trial. Henning, this is a little bit of a surprise as far as the outcomes are concerned. So I'm not going to give it away. You tell me what the trial is. It's a POET trial. Tell me how it works and how the trial was done.
We randomized 400 patients with endocarditis, and half of them were randomized to continued conventional intravenous antibiotic therapy, and the other half were randomized after a stabilization period to tablets, and those who were offered tablet treatment were offered to go home if possible.
So tell me how long that period was of stabilization. What does that mean?
Stabilization meant that the patients should be afebrile, they should have reduced levels of infectious parameters, and they should have a transesophageal echocardiography that was not worrisome.
Okay, so, and that can happen in what, 3 or 4 days, 5 days?
Now, they had to be on antibiotics for at least 10 days or 7 days after surgery. And in fact, they were randomized after 17 days on IV antibiotics.
Okay.
Conclusion. In part, we endocarditis that are in stable conditional oral treatment is efficiencies and safest and parental therapy is suggested by a little rewarding. Be pharmacokinetic conditional. It is evident that endocarditis continue to be a changes for health professionals because the clinical features make treatment of the condition complete.
inflammation of the inner lining of the heart, known as endocardium. This inflammation is a consequence of two factors, which are the presence of organisms in the bloodstream and the abnormal cardiac endothelium facilitating the adherence of the microorganisms and their growth. The risk factors for this colonization of the inner lining of the heart, endocarditis, is underlying structural valve defects such as right heart defect, congenital heart diseases, prosthetic valves, intravenous drug use, and bacteremia that is due to poor dental hygiene, dental treatment, heart surgery, IV cannula, especially the central lines, and soft tissue infections. This endocarditis can be classified into two, that is the acute endocarditis and subacute. In acute endocarditis, it is a valvular illness which rapidly damages the cardiac structures hematogenously, seeding extracardiac sites, and if untreated, it progresses to death within weeks. It is usually due to virulent organisms, which affects the normal valves such as Staphylococcus aureus and Streptococcus.